I was recently talking to a woman, and she was telling me that she almost died from sepsis recently. As we were talking, I explained that my mother recently passed away, and the woman ended up saying something that just really irked me. She said that one of the reasons why healthcare in America is so bad is because it's socialized. I can tell you, because I ended up shredding 12 bags of my mom's old bills, that nothing could be further from the truth. People are paying considerable amounts to stay healthy in this country. How do you call that socialized medicine? Many hospitals, certainly nursing homes, as my mother would attest to if she were still alive, are understaffed. Many of the workers in medical institutions are overwhelmed, working a lot more hours than most Americans do. For the woman to say that this was socialized medicine tells me that she doesn't really understand what socialism is. So to counter that, I'm going to try to explain it and explain the difference between what healthcare in America used to be in comparison to what it is now. Socialism doesn't say that companies can't exist. What socialism traditionally meant was that the means of production, the things, the resources, the services that were necessary for everyone would be run through the government. Certainly you could say that Medicare and Medicaid and the Veterans Administration fall into that category. But not for the rest of us who have to go and pay for insurance or pay deductions or have to deal with Medicare Advantage or deal with denials of coverage and might have to appeal. That's not socialized medicine. People going poor, going bankrupt to pay for medical bills, for life sustenance, that is not socialism. The countries in the world that offer socialized medicine, which are most, if not majority, of the countries in the world, the majority of industrialized countries in the world offer socialized medicine. America does not. Even the people who allowed things like Obamacare. If you don't understand a topic, you shouldn't get into a debate about it. I have several videos explaining what socialism is and why it would be good for America. I also discuss it in my video, Americans Don't Like to Talk About Money. I highly recommend watching that video. It explains a lot of the situation that we're currently in this country. But the things that people think are socialism aren't always. We have an obligation to ourselves and our countrymen to be educated on these topics. How can we vote? How can we be cognizant of what's going on in the world if we don't understand the facts? If we don't get reliable news? If we understand the difference between real news and fake news? If we understand media literacy? If we actively engage in participation in politics? And that's everyone's right and obligation. The medical system in this country is not socialized. It was more socialized 50 years ago when people used to have better coverages, what they used to call major medical. Very, very few people have that nowadays. And a lot of the changes had to do with making the medical professions, making the medical industries in this country a for-profit, making them for-profit. Now, not all of them are. Some are still non-profit or not for-profit, but a lot of them are. And it's more important to them to deny coverages. And this is really the problem, because insurance makes money off of denying us coverages. That's why it's so hard to win when you're fighting against multi-billion-dollar healthcare companies, health insurance companies. And then you have the other problem where a lot of hospitals and even doctors' offices will give you tests that you really don't need, just so they can go and up the amount of money they end up charging you and your insurance, if you have it. If we had a socialized framework for healthcare in this country, we wouldn't be paying companies insurance. We'd be paying into the system through our taxes. We may or may not have any deductions when we go to the doctor or go to a hospital or to a nursing home or to a hospice. These things would be covered, and only if it was medically necessary. Even countries that do have socialized medicine still have private insurance for things like plastic surgery, or if you want to go and get a test that your doctor doesn't think you need. Wouldn't we be all better off as individuals and as citizens if all of our basic needs were met? I don't understand people who don't like socialized medicine, who don't believe in universal health care or a single payer system. Even if you have great insurance, which I've heard that argument before, until people actually need to use it. Even if you had great insurance, isn't it our right, our obligation as a nation to care for all of us? Let me know what your thoughts are on socialized medicine and universal health care, and if you believe, or if you've been taught or told that healthcare in America is socialized. Take care, and thank you very much for watching.